What's the most unprofessional thing a doctor has ever said to you? I was sent for a uterine scan because of some health issues. Beforehand, I was told that if the regular ultrasound didn't give clear enough images, they might need to do a transvaginal one. So I was already feeling nervous and uncomfortable going in. When I arrived, I saw that the technician was a man, and he was the only one in the room. That made me even more anxious, but I tried to calm myself by thinking, he probably does this all the time. It's just another day at work for him. During the scan, he rested the arm holding the scanner on my upper thigh, and his wrist was against my lower abdomen. I kept trying to tell myself it must just be part of the procedure, that maybe real ultrasounds aren't like the ones in movies. Then he pointed at the screen, showing me my uterus, and said softly, "So perfect. One day there will be a baby in there." That comment made me deeply uncomfortable. Even now, thinking back to it still makes my skin crawl. I'm very thankful the regular scan was clear enough and that they didn't need to do the transvaginal one. Story 2. During one appointment, I was told I needed to remove my shirt for the exam. The doctor, who I'd already felt uneasy around, didn't step out of the room or give me privacy. Instead, he stayed there while I got ready. I actually had to ask him to turn around if he wasn't going to leave. The whole situation made me really uncomfortable, and after that, I decided not to go back to him. Once I was ready for the exam, he barely focused on anything medical. Instead, he kept staring at my chest while talking, and his behavior made me feel really uncomfortable. He crossed professional boundaries, making completely inappropriate comments about my body and how, if he wasn't married, he'd confidently cross the boundary with me. He said it in a much more offensive way that I don't feel like sharing. He also proceeded to complain about his wife's body. Needless to say, I left before things could go any further, before I even got a diagnosis or found out if anything was actually wrong. It felt like he did more talking than any kind of real exam. Now, I see a younger female doctor who makes me feel so much more comfortable and respected. I never even told my parents about what happened at the time because I wasn't sure if I was overreacting or not. Anyway, thank you for listening to one of the worst experiences of my life. Story 3. After my C-section, I asked a nurse for some Benadryl because I was experiencing intense itching. She said, "I can't give you anything for random itching. You're breastfeeding, and it'll cause drowsiness for you and the baby. You'll just have to suck it up." Then she handed me my son from his bassinet and told me that skin-to-skin contact was best. I was burning up, and while my son was calm, he wasn't latching or showing any interest in feeding. She had moved the crib just far enough away that I couldn't reach it to put him back. Every inch of my skin burned like I'd been stung by nettles. 45 minutes later, I was covered in hives, crying from hormones, itching and pain, and convinced I was having an allergic reaction to something. My son was falling asleep on me while I scratched my arms until they bled. I rang the call bell. A different nurse came in and said, "Oh, good Lord, you're having a reaction to something. Poor thing, you look uncomfortable. Let's get you sorted out." I asked her about breastfeeding, and she said, "Baby won't starve, and you won't be feeling much like feeding if you're scratching your breasts off. Now will you?" She gave me Benadryl through my IV, along with a little extra pain medication. It turned out I wasn't allergic to anything specific. I just had some kind of strange immune response. She took my son, dressed him up in a couple of the outfits I'd brought — he was born on Halloween — and kept him at the nurse's station for about an hour and a half while I slept. When my husband came by later, he'd been dropping our older son off at my brother's after daycare. The nurses were all taking turns holding our 8-hour-old baby. I slept a solid 3 hours and woke up feeling like $1,000,000. Didn't see Benadryl denying Betsy again. Bish. Story 4. This didn't happen to me, but back in the early 2000s, my dad started having trouble breathing. He went to the emergency walk-in clinic where the doctor told him, "Oh, you just have a small chest infection. Go home and rest." At 1 in the morning, my mom had to call an ambulance because my dad couldn't breathe at all. It turned out that his small chest infection was actually a massive blood clot that had completely filled one of his lungs and was on its way to his heart. He pulled through, thankfully, but he was left with permanently scarred lungs. Story 5. I have a very common birth defect called pectus excavatum that's been causing me problems since I was about 16. My sternum doesn't lie flat. It curves inward, and it puts pressure on my lungs, making most cardio nearly impossible. Rescue inhalers don't help because I don't have asthma. Over the years, I had a primary care physician, a nurse practitioner, another primary care physician, and even a geneticist all tell me I had a mild chest wall deformity, if even that. Every time, I just said, okay. Then I went to the ER for an unrelated issue, and the MRI technician decided to calculate my Haller index, which measures the severity of chest wall deformities. For reference, 0 to 2.5 is normal, 2.5 to 3.2 is mild, 3.2 to 3.8 is moderate, 3.9 and above is severe. Mine was 4.2. How do you mess up that badly? Story 6. I took my mom to see a neurologist because her primary care doctor suspected she had Parkinson's. After waiting almost an hour, the neurologist came in, took a quick look, told us she had Parkinson's, then told us to watch some YouTube videos explaining what Parkinson's was, and left the room. The entire visit lasted less than a minute. Edit. This seems to have struck a nerve, so here's some context. Yes, I'm in the United States. Bad clinicians exist everywhere, so I don't think this apathy was about location. He was in private practice. We've since found a much better neurologist who has been treating my mom. Yes, they still charged insurance. My mom is on Medicare, so it didn't turn into crushing debt. I didn't report the doctor, I just didn't have the energy at the time. Story 7. My doctor said, nope, I can't feel any lump. I was convinced I felt a lump in my testicle, but the doctor couldn't find anything. It ended up taking far longer than it should have, about 6 weeks, to get an ultrasound. And yes, it turned out to be cancer. I'm all good now, but that whole experience was absolute nonsense. Edit. Since this post has gotten some attention, here's a bit more information about testicular cancer. Testicular cancer is the most common type of cancer in men aged 20 to 35. Thankfully, it's also one of the most treatable cancers today, so don't panic if you ever notice a lump. The lump I felt was about the size of a small BB inside my testicle. Not very noticeable. It was firm and didn't give at all when pressed. Usually, there's no pain with the tumor. I could feel it when gently holding my testicle between my thumb and forefinger. I should also mention that I had to insist something felt wrong during my doctor's visit. If I hadn't pushed, I probably wouldn't have gotten that ultrasound. If something feels off, trust yourself. Story 8. The doctor told me that if I wanted to start treatment and get a spot on the ward, I'd have to shave off all my hair. Worth noting, the treatment had absolutely nothing to do with my head. She had zero bedside manner, was rude to other medical staff, and generally acted like she didn't care. I told the nurse I was having second thoughts about staying on the ward, but she encouraged me to give it a try. On my first day, the doctor greeted me with, "Hi, remember me? I'm that doctor you hate." What kind of way is that to speak to someone who's sick and already struggling mentally? Story 9. I developed diabetic ketoacidosis because I wasn't managing my type 1 diabetes well and had a severe stomach bug. I hadn't eaten in days and was dealing with awful diarrhea. While I was being treated in the ICU, I had an accident and ended up soiling the bed. I wasn't allowed to get up on my own and no one was answering the call button, which I completely understand. People in the ICU are fighting for their lives, and I just needed close monitoring for my insulin drip. When the CNA came in with a new trainee shadowing her, the trainee audibly gagged and acted disgusted, even swearing under her breath while changing the sheets. I understand. Poop is gross, but I was already mortified and ashamed. The main CNA quickly told her to step out and apologize to me for her behavior. I just asked that the trainee not come back, and thankfully, they respected that. Story 10. I was 18 when I found a lump in my breast. I was terrified. My mother took me to her gynecologist because she didn't trust mine, someone she'd never even met. The doctor examined me and told me I had something called fibrocystic disease. He said hormones could make it worse. Since I was on oral birth control, I asked if I should stop taking the pill. He said I shouldn't be on the pill in the first place and then walked out of the room without another word. No explanation of what fibrocystic disease was. No guidance, no follow-up care. I waited about 20 minutes for someone to come back, then finally got dressed, coat and all, and just sat there waiting. About 15 minutes later, a nurse walked in, looked at me, and said, "You can get dressed now." I said, "I am dressed." She looked at me again, turned around, and left without saying a word. I walked out and never went back. Later, I went to my college library to look up fibrocystic disease, but I still couldn't figure out how serious it was or what I was supposed to do next. I eventually went to a different gynecologist. Turns out, I didn't have fibrocystic disease at all. I just had fibrous breast tissue. I ended up having the lump removed because it was so painful. I haven't had any lumps or pain since. That first doctor can go F himself. Oh, and my mother, who's the one who originally put me on birth control, said the doctor was right, that I shouldn't be on it. Nothing like feeling cared for and supported by both your parent and your doctor. Story 11. Unprofessional but funny. I had taken my 92-year-old mother to a recheck appointment with her primary care physician. An apparently new medical assistant was dutifully going through the intake checklist. When she asked when Mom's last period was, I glanced at Mom a little nervously. She was very old school, dignified, and would never normally acknowledge to her sons that she had female parts. I saw a rare twinkle in her eyes as she calmly replied, "Well, I can't give you an exact number of months, but I'm pretty sure it was sometime in the late 1960s. The assistant had the good grace to laugh with us, apologize, and then move on to the next question. Do you think you might be pregnant? Oh God. Story 12. When I was about 12 or 13, I had a bad head injury and ended up seeing a bunch of doctors while they tried to figure out what was going on. I got a little snippy with one of them over something I don't even remember. Years later, I pulled up my old medical record and saw that she had described me as a child of the devil. Let's just say it took a few phone calls to get that particular diagnosis removed from my record. Story 13. Define unprofessional. I think it's unprofessional to lie to people's faces, but what do I know? For context, this takes place in Germany. My grandfather-in-law has severe dementia. He lived alone, but my mother-in-law and I visited him 3 times a day to make sure he ate, took his medication, and had some company. A few weeks ago, he couldn't get up in the morning and said his hip hurt, so my mother-in-law drove him to the hospital. But because of COVID, she wasn't allowed into the emergency room. So this confused elderly man sat there for 4 hours. And when the doctor finally asked what was wrong, what did he say? I don't know. Of course he didn't. Sitting down, his hip didn't hurt as much anymore. He had no idea why he was even there. So the doctor calls my mother-in-law and tells her he's fine and can go home. My mother-in-law was skeptical, so she asked point blank, "Can he move? Can he go to the toilet alone?" And what did the doctor say all 3 times she asked, just to be sure? Yeah, he's fine. He then proceeds to send my grandfather-in-law home, with 2 guys carrying him into the house in a special chair because he couldn't even manage to walk that short distance by himself. All of this happened on a Friday. We spent the entire weekend at his place, helping him move around and get to the toilet. On Monday, we brought him back to the emergency room. And guess what? No, really, guess what was wrong with him? He had broken his hip. This poor man spent 3 days shuffling around with a handcart, with a broken hip. But sure, he's fine. Story 14. I went in because I thought I might have a urinary tract infection. I'd been on birth control for a while, so doing the usual test wasn't anything new to me. I gave a sample at the appointment. It was routine, and I knew what to expect. The doctor started acting a little strange about it. He kept asking if I knew how to give a sample or if I needed instructions on how to do it. Mind you, this was after I had already finished. He knew that. And by now, it was something I was completely used to. I knew I hadn't done anything wrong, but he kept bringing up the whole sample thing and then asked me if I got it on myself, completely out of line for a doctor. I remember feeling shocked and uncomfortable because it just didn't seem like a professional question at all. I was completely appalled. First of all, no, that's not an issue I have, and second, why was he so interested in it? Story 15. It wasn't a doctor, but a nurse, and it happened recently. I was hospitalized after a pretty bad car accident. Because of the surgery and general trauma, I could feel the urge to urinate, but couldn't get the muscles to relax enough to actually go on my own. For the first day, they were doing in and out catheters whenever I said something like, "Hey, I've got to pee and I can't. Please help." It was uncomfortable, but I managed, at least until I got to the night nurse. Around 8:30, I told her, "Hey, I need help with this." She did a bladder scan and said, "Not enough urine right now." 10:30 rolls around, I tell her again, and she says, "I did the bladder scan, you're fine." Then at 12:30, she insists, I did the bladder scan at 10, it's not enough urine. So now she's lying to me. I finally got her to do the catheter at 4 in the morning, where she proceeded to drain 1.3 liters of urine from my bladder. Story 16. When I was in junior high, I tried out for the basketball team. Part of the process was taking a physical, and it had to be done by the school's doctor instead of my own. I went in for the exam and had to undress completely. The doctor looked me over, noticed my inverted breastbone, and said, "Wow, that's freakish. You can't be on the team with that." I know my breastbone makes it look like there's a hole in my chest, but I had never felt self-conscious about it. Until that moment. Because the examination took place in the boys' locker room. In front of other kids who were also trying out for the team, everyone started laughing at me and calling me names. I grabbed my things and left. My mother took me to our regular doctor, who reassured me that there was nothing wrong with me and that plenty of people have breastbones just like mine. It didn't make me feel any better, but I appreciated that she took the time to explain it. After that, I stopped taking my shirt off in front of others. I was harassed and bullied by my entire class for years because of a comment a doctor never should have made. Story 17. A few years ago, I messed up my hip. I went to urgent care, and they told me it was a strained lap band. I mentioned this to my sister, she's an athletic trainer, and she told me to lie on my side with a pillow between my legs to help with the pain. It didn't help. In fact, it hurt so badly that every muscle in my body locked up, and my husband had to push me onto my back. That Monday morning, I made an appointment. When I went in, I told the doctor everything that had happened. She rolled her eyes and said, "It's a strained lap band. You're overthinking this. It'll be fine if you rest." I repeated what my sister had told me, and the doctor basically implied that my sister was out of her depth and was just making me paranoid. I pushed back a bit, and she finally agreed to examine me. Let me tell you, I have no idea what she did, but whatever it wasn't gentle. It hurt so badly that I actually yelled and started crying. Then she had the nerve to look at me and say, "Oh, that's not your lap band." No kidding, lady. And then she wanted to go right back to examining me. I was so furious that I filed a complaint. Turns out I had torn several connective tissues and chipped off a few pieces of bone. I ended up on medical leave for almost 4 months. I worked in retail. But sure, I was just being a hypochondriac. Story 18. She tried to give me essential oils and told me to come back tomorrow while I was having a life-threatening allergic reaction. My throat was swelling shut. I could barely breathe. My eyes were swollen closed and covered in pus, and my entire body felt awful. This was after she had already been advised by the emergency room to give me a shot if I ever came in with this kind of reaction. Her office was closer than the ER, so they told me to go to her next time, instead of wasting precious time driving all the way there. In the end, I had to drive myself. 10 minutes to her office, then 45 minutes to the ER, plus the time wasted arguing with her, just to save my own life. Yes, I have a different doctor now. Hard to believe, she used to be an actual doctor. Story 19. My mom never went full anti-vax, but she was really into holistic medicine and other kinds of nonsense. When I was in 5th grade, I needed a vaccine for school, so she sent me to some holistic clinic. The so-called doctor seemed nervous from the start of the appointment. She stuck the needle in my arm, let out a quiet, "uh-oh," and then collapsed onto one knee right there on the floor. The needle was still stuck in my arm, gently bouncing up and down. The doctor stood back up and apologized for almost passing out. Then she admitted she had never given a vaccination before. I'm honestly surprised I'm still alive after that, and to this day, I wonder what was actually injected into my arm. I looked her up later, and she does have MD listed next to her name on her website, but at this point, I'm convinced it stands for mock doctor or something. Story 20. I had a period that lasted more than 20 days, about 2 months after a miscarriage. It wasn't slowing down. I went to a doctor on day 9. He told me I wasn't having a miscarriage while standing in the hallway next to the waiting room, and actually yelled it into the room I was in before walking away. I went to another doctor on day 18. He told me to calm down and that it would stop. I was calm. Finally, I went to another doctor on day 20. He gave me medication to help my blood clot, and it finally stopped on day 22. A month later, I started having excruciating pain in my left ovary. So intense that I was vomiting, and painkillers didn't even touch it. I went to the hospital about 12 hours after the pain began. The doctor there didn't run any tests, didn't examine me, and didn't ask a single question. Instead, he went on a rant about how women are hysterical and rush to the emergency room for anything, like soaking a pad in an hour or passing large blood clots. You know, the exact things we're told by doctors to seek help for. Story 21. I got a condescending lecture from both a doctor at a Catheter walk-in clinic and my GP a week later during a follow-up appointment about how I shouldn't have come in just for a cold. A few weeks later, I ended up being rushed into resuscitation with a punctured lung. It had created a one-way valve in my lung where air could escape into my chest cavity, but couldn't get back out. Because it was brushed off and never properly investigated, it turned into a life-threatening condition called tension pneumothorax. The pressure that built up on one side of my chest caused my lung to collapse completely and started crushing my heart and other lung. It also compressed and twisted the arteries, veins, and even the esophagus in my neck. When they put a chest drain in, my chest cavity literally sounded like it was deflating, just like a car tire with a puncture. Story 22. It's just a cold. It should pass in a week. That's what he told me after I explained that I'd been getting horrible headaches once or twice a week for the last 5 years. Sometimes they came with vomiting and a low fever. He probably only heard the words headache and fever and brushed off everything else because I was just a 19-year-old woman. I was later diagnosed with migraines, but no medication has really worked for me. Thankfully, after 4 pregnancies and 2 kids, the episodes have become less frequent and easier to manage. Story 23. You should read religious self-help book to cure your anxiety. Do you want to be taking a pill for the rest of your life? He may have been an NP, but I wanted to hit him. Pushing a religious solution onto a medical problem without any invitation is insulting and unprofessional, especially to someone who's too anxious to push back. Joke's on him. My anxiety is comorbid with ADHD, so now I take 2 pills. Story 24. I wasn't feeling particularly well, so I went in to have my blood tested. The doctor was very professional, almost detached. Yeah, you look a little pale. Is your heart rate normally this high? Well, we'll look at the lab results and figure out what's going on. About 10 minutes later, he came back, out of breath and clearly panicked. Did you drive here? Yeah. Well, you're not driving out of here. If you can't get a ride to hospital A or B within 20 minutes, I'm sending you by ambulance. Your hemoglobin is 6.2. You could have cancer. Needless to say, I don't remember much after hearing the C word. I do remember being really scared and shedding a tear in the parking lot while waiting for my mom. After a blood transfusion, just about every test imaginable and in all the orifices, and 3 days in the hospital, they finally figured it out. I have a type of anemia that just requires a B12 shot once a month. Much better than cancer. That doctor is still my primary care physician. She's amazing and seems to care more about my health than any other doctor I've ever seen. And trust me, I've seen plenty. Story 25. This wasn't a doctor, but a couple of years ago, I had to get blood drawn at a lab. When they called me in, I sat down in the chair and laid my arm out on the table so they could take the sample. At the time, some old self-harm scars on my arm were still pretty visible, and it's something I've always been self-conscious about. The phlebotomist gasped when she saw them and said, "How ugly! What could have ever made you do that to yourself?" Then she just stood there, waiting for an answer. Her tone wasn't one of concern. It was disgust. I told her it was private and asked if we could just start the blood draw. I had to repeat myself several times before she finally began. While she was drawing my blood, she kept talking, telling me I was too young to be depressed and that the scars were such a horrible thing to do to myself. I couldn't leave because there was a needle in my arm. My face was burning red. Tears filled my eyes, and I was so embarrassed and upset that I couldn't say a word. I just waited for it to be over, and the moment she was done, I ran out the door. I found an online feedback form for the company and submitted a complaint, and I also left a voicemail on their customer service line. I never got a response, but I just hope someone spoke to that phlebotomist about what happened, and that no one else with such scars is ever made to feel as embarrassed and ashamed as I was. Story 26. A few years back, I started feeling short of breath. I'm not in the best physical shape, but it still alarmed me. I went to my general practitioner and he sent me for a stress test. Treadmill, EKG, the works. When the results came in, I sat in his office expecting the worst. He came in with my chart, his expression serious. Being an impatient patient, I said, "Give it to me straight, doc." He looked up from the chart and said, "You've got the heart of a 16-year-old runner, big fella. You're just fat." It was unprofessional. But honestly, I appreciated it. Story 27. I'm a 32-year-old woman, and after moving to a different country, my anxiety and depression started to feel unmanageable, even though I was genuinely happy. I had moved to be with my now husband, but adjusting to a new country and culture turned out to be much harder than I ever expected. I started looking for a primary care doctor and made an appointment with one I found on Google. As I began explaining what was going on, I broke down in tears. He looked irritated and told me I just needed to get some sunlight and exercise more. For context, I'm 5'9" and weighed about 130 pounds at the time. I also ended up breaking down during an appointment with my gynecologist. She decided to run some blood work and discovered that I had a thyroid issue, which can cause anxiety. Over time, my thyroid levels improved, but something still felt off. 4 years, and several doctors later, I had started self-medicating with alcohol. As a last effort, I decided to try once more to get some real support. My new doctor assured me that my mental health mattered and referred me to a therapist, who then referred me to a psychologist after hearing about my daily struggles. It turns out, I've been living with inattentive ADHD all along. I just started medication a week ago. Story 28. I hurt my leg and thought it might be broken. When the doctor came in, he immediately noticed that I have very high arches in my feet. He then proceeded to call in several colleagues from around the hospital to come look at them. My feet had nothing to do with the injury, and diagnosing my legs seemed like a secondary concern compared to their fascination with my arches. I'm a guy, but after that experience, I started wondering if I should open an OF page just to sell high arch pictures. Story 29. When I was a young teen, an orthopedic surgeon evaluating me for foot pain leaned in close and whispered in my ear, "Have you started your period yet?" He went on to explain that the type of surgery he wasn't qualified to perform wouldn't be suitable because I'd started puberty, but that another procedure, one he could do, would work instead. It didn't. And he doesn't have his medical license anymore either. Story 30. I was explaining my migraine symptoms to a former doctor of mine when she got this confused look on her face. She turned back to her laptop, opened Google, and typed in migraine symptoms right in front of me. Then she said, "Oh, yeah, it says that's a symptom." The next story's titled, "Doctors Do Not Listen to Women," but honestly, that could be the title of this entire comment section. Another time, I went to my OBGYN about severe hormone issues, worsening migraines, heavy periods, a bloated lower abdomen, and intense cramping. I told her something felt wrong with my hormones. She cut me off and said, "There's nothing wrong with your hormones. You're just sensitive to their fluctuations." The way she said it, the tone, the inflection, it was clear she meant you're just being sensitive. She didn't order a single test. Nothing. 3 months later, I went to the hospital for severe groin pain. The medical staff eventually discovered a 1-pound tumor growing straight through my uterus, destroying the uterine walls. But they didn't find it right away. The first doctor I saw insisted I just had a bladder infection. My urinalysis came back negative, but he put me on antibiotics anyway, saying, "Sometimes tests are negative because people drink too much water." A week later, I went back and demanded a deeper investigation. It took another couple of weeks, and finally an MRI to uncover the truth. I'd taken the antibiotics for nothing. No one wanted to dig deeper or listen to me. It wasn't just exhausting to keep going back, it was expensive. And that's the worst part. Women in America pay so much money just to be ignored by doctors. The tumor was so large it had actually developed its own circulatory system, complete with flow voids, which sounds almost Lovecraftian. I had to get a hysterectomy. When they removed everything, the tumor turned out to be 3 times bigger than my uterus. It looked like a cow's stomach or something. Story 31. I got into a car accident but didn't have insurance at the time. Over the next few months, my neck and shoulders started making loud cracking sounds every time I moved. Once I finally got a job and insurance, I went to see a doctor. He looked me over and said, "Skinny people crack more." I looked him straight in the eye and said, "I've been skinny my whole life. What the hell are you talking about?" I went to another doctor and found out I had microfractures in my spine, snapping scapula, and nerve damage. I'm pretty sure that first orthopedic doctor was just so used to dealing with older patients that when he saw me, a 25-year-old guy, He figured I could just work it out. He didn't even want to authorize any scans. It's been 2 years, and I still have the cracking. Story 32. I'd been seeing a pain doctor for a while. They had me on the lowest dose of Norco, 5 milligrams 3 times a day. After a couple of months, I developed a tolerance, and 3 a day just wasn't cutting it anymore. At my next appointment, I told the PA, since I rarely saw the actual doctor, maybe once every 6 to 8 weeks, if that, what was going on. She said she'd increase the prescription to 4 a day. Normally, my prescription was 90 tablets for 30 days, but this time she upped it to 100 and didn't say anything else. Cue the next office visit. Fine, I said, except you miswrote the prescription last month. You upped the dosage to 4 per day, so the script ran out in 25 days instead of 30. She frowned slightly. So you finished your meds early? Actually, no, I replied, keeping my voice even. I set the bottle on the counter. I finished them exactly as prescribed, 4 per day, quantity 100, that's 25 days. Her expression hardened. No, you finished the meds early. You're abusing it. I stared at her, trying to process what she just said. How am I abusing it when I took it exactly as written? Because you finished the meds early, she repeated flatly, as if saying it enough times would make it true. An argument followed. One of those tense circular ones where logic just didn't seem to matter. Eventually, I found out that the PA had meant to write the prescription as 3 per day, with 10 extra tablets for breakthrough pain. Not 4 per day. She just wouldn't admit she'd made a mistake. Instead, she went to talk to the doctor, who also refused to acknowledge the error, and then they dropped me as a patient. It wasn't even done properly. What they did was considered patient abandonment. They didn't formally discharge me until I threatened to take legal action. In retrospect, I'd say the entire practice was unprofessional, and I don't mean that as a spurned ex-patient, it's just the truth. Looking back, the doctor always seemed more interested in high-dollar treatments like stem cell therapy or approving medical marijuana cards. When I didn't go for those options, the whole thing started feeling like a cash for scripts operation, and I was gradually pawned off on underlings. Story 33. The doctor looked at me over her glasses and said, "Mrs. X, you're 11 weeks pregnant, you've got 2 children, and I've already seen you 3 times with this pregnancy. What could you possibly have to see me for this time?" "I miscarried yesterday," I said quietly. She blinked, then replied flatly, "Oh, we'll need to book you in for a D&C." "Actually, no," I said, holding her gaze. "I went to the hospital. I miscarried 1 baby, but I'm still pregnant with the twin." Years later, after I'd moved away and eventually returned to the same practice, it's hard to get into a new one, and they already had some of my records. I saw her again. When she entered the room, she smiled softly and said, "Mrs. X, lovely to see you again. Can I start by apologizing for the way I treated you all those years ago? I've since become a mother myself and have really worked on how I deal with my patients." Her sincerity caught me off guard, and I smiled back. She's been my favorite GP ever since, and she hasn't put a foot wrong in the 10 years since. Story 34. My doctor once asked if I had a crush on a boy, and I said yes. Then she asked if I knew what physical intimacy was, and I said yes. Somehow, that led her to decide I must be doing it. And no matter how many times I denied it, she never believed me. After a few checkups, I got so sick of the conversation that I told her I didn't like boys, girls, or anyone. So, naturally, she decided I was a lesbian who was too afraid of my parents to admit it. I'm not a lesbian, and she remains the worst doctor I've ever had. And that's saying something, considering I once had a doctor who would preemptively pin children down to give them shots. Story 35. You shouldn't be in pain. Just do more sports or something. That's what my doctor said to me. I have scoliosis, and the pain I deal with is horrible. I've tried building muscle. I've tried every recommendation, but the pain just keeps getting worse every day. My curvature isn't considered extreme. It's about 42 degrees and S-shaped, meaning there are 3 curves in my spine. But because I don't look visibly crooked or deformed, everyone assumes I'm fine. They think that since I don't necessarily need surgery, I shouldn't be in pain. When my doctor said that, I wanted to break down right there. It would have been better if she'd just told me the pain would never go away, rather than dismiss what I live with every single day. Story 36. This wasn't said to me, but to a patient. I'm a fourth-year medical student, and during my surgery rotation last year, I had the utter misfortune of working with a pediatric surgeon who was notorious for being cruel to students and residents. Honestly, after all the abuse I'd already endured since starting third year, I'd learned to tune most of it out. That changed when we went to see a 6-year-old with lymphoma. The child, understandably, didn't want to sit still for the exam. He was 6 and in a hospital after all. The surgeon got frustrated, threw up his hands, and stormed out of the room shouting, "It doesn't matter, he'll be gone soon anyway." Yes, the patient and his mother heard. And no, nothing was done about it, because hospitals protect surgeons. Story 37. When I was 19, I went to a gynecologist because I started bleeding and cramping badly between cycles. The first thing she asked was whether I was sexually active, which was fair. But I told her I hadn't been for about 3 months since my boyfriend was out of state. Then she asked my race. I told her I'm Latina, and she immediately said, "Oh, okay, you're probably pregnant. You guys get it on like bunnies." She ran a pregnancy test anyway. When it came back negative, all she said was, "Well, come back if it happens again." And that was the entire visit. Story 38. I have so many I don't even know where to start. The most unprofessional experience I've ever had was when I hit puberty and suddenly developed stretch marks across my hips and thighs. My family GP looked at them and laughed, saying, "You're getting to be a bit of a fatty then, aren't you? Ease off the cookies already." At the time, I was an active, healthy dancer. Years later, I found out I have a genetic condition called lipedema. That one careless comment stuck with me. I developed a severe eating disorder and still struggle with body dysmorphia, even 30 years later. Screw Dr. Bausted and every other bully or friend who laughed at me for something completely outside of my control. After years of therapy, I still struggle to reconcile the fact that a healthy, active, normal-looking person can have thighs like mine, no matter how dangerously thin I became in the past. But it was him, the medical professional, who convinced me for years that I was just a fatty, that I'd eaten too many cookies, and that my body was a joke. Story 39. My primary doctor moved away, and her replacement was the complete opposite of her. At my very first checkup, he told me he'd be canceling my prescription for 10 Xanax a month for my panic disorder because he doesn't like these drugs. He went on to say that my dose was so low it probably wasn't even effective, that it was all just in my head, and that I didn't need anxiety medication anymore. Story 40. I was shopping around for a new family doctor. Near the end of my appointment, she asked if there were any other health concerns I wanted to bring up. I told her about my recurring sleep paralysis, what it felt like, how often it happened, how long I'd been experiencing it, and what usually triggered it. She asked why I thought it was sleep paralysis, and I explained that I'd looked it up online and that my experiences matched what other people described. She rolled her eyes and said, "Just because you Googled something doesn't mean you have it." It took everything in me not to cry right there in her office. Story 41. During a checkup for a mental health medication refill, my doctor looked at me and said, "Your alpha personality makes you think you know what you're talking about." He seemed fresh out of med school, and I almost lost it. You don't criticize or judge someone in a fragile mental state. Doing that only makes things worse. The result is the exact opposite of what you should be trying to achieve. Story 42. My son had a rare nerve syndrome, RSD, that made any touch to his right arm excruciatingly painful. I lost track of how many doctors we saw and how many treatments he was put through. One doctor, at a prominent children's hospital in central Pennsylvania, stands out. He pulled me aside and told me my son was faking everything. I reported him to the hospital immediately. It's been 6 years, and it still makes me angry. Story 43. I Baker acted myself, which for anyone outside Florida is a law that allows you to voluntarily check into a mental or behavioral health facility for up to 3 days if you're having suicidal or dangerous thoughts. They ran some blood work, and around 11 p.m., a doctor walked in and said, "You've got a lot of smudge cells, so we're going to run a few tests for lymphoblastic leukemia." Then he just left for the night. I was in the hospital for suicidal thoughts, and this man dropped blood cancer on me before clocking out. Turns out my smudge cell count was high because I'd had COVID about 4 months earlier, which apparently is a common thing afterward. I spent 2 frigging days panicking, asking every nurse what was going on, and all they could tell me was that the doctor wasn't in and they couldn't give me a concrete answer. The next few doctors said they'd look into it and then never came back. 4 different doctors basically shrugged and said, "Yeah, he might be right." And that was it. No explanations, no reassurance, nothing. Then I got transferred to the behavioral institution, still thinking I might have blood cancer. It wasn't until weeks later, after I was released and got a second opinion, that I finally learned the truth. Several weeks of pure anxiety, because 5 doctors couldn't be bothered to explain their logic to a suicidal man. Story 44. I went in to get some guidance about my mental health and mentioned that I'd been having intrusive thoughts. The doctor looked at me and said, and I quote, "When you actually come up with a plan to take your life, then we'll take your concerns into consideration." This was my family physician. Edit. Okay, I need to clear something up. I don't have the willpower to actually take my own life. The intrusive thoughts come from anywhere, but they stay as thoughts. They never turn into actions because I simply don't have the physical will or desire to go through with it. I've had a lot of trauma in my life, and I'm only 28. I have ADHD and developed a lot of trauma responses, flinching being the most noticeable, from years of childhood abuse. I've also become pretty numb to the idea of death. It happens to everyone eventually. I'm just not willing to make it happen by my own hands. Still, thinking about how easy it could be to do it crosses my mind every day, especially when I hit a low point. And I'll never speak poorly of those who do go through with it, because I understand how heavy life can get and how deeply death can ripple through the people left behind. Story 45. I had a headache that lasted for 3 straight months, along with vertigo, nausea, and fainting. It took forever for anyone to figure out what was wrong. I kept telling every doctor that I had a hole in my eardrum and thought it might be related, but they all dismissed it. An MRI eventually showed that the bones on one side of my skull were infected, so they ordered a CT scan of my inner ear. It revealed a cyst. When I went to the ear, nose, and throat specialist, he told me there was no way that cyst could be causing my headaches, that if it were, only the right side of my head would hurt. I found a new ENT and had the cyst removed, and wouldn't you know it, the headache disappeared. Story 46. I was 35 and told my OB/GYN that I would like to go through with a C-section. My OB/GYN raised an eyebrow and asked, "What does your husband think of this? Women have had natural births for thousands of years." Backstory. I had my baby in the fall of 2020 after more than 7 years of infertility. Somehow I got pregnant naturally without any medical help. I found out I was expecting on the same day COVID was declared a pandemic. Given everything, the years of trying, the global chaos, and my history of anxiety, I was understandably nervous. All I wanted was to bring a healthy baby safely into the world. I asked about choosing a C-section instead of attempting a natural birth. In Canada, it's perfectly legal and well known that you can choose a C-section even without a medical reason, and doctors aren't allowed to refuse. I explained that I'm a very small woman. It runs in my family, including my mom, aunts, and grandmother, and that we have a long history of complicated births and emergency C-sections. There had even been stillbirths and 2 babies with brain injuries. I shared all of this, along with my ongoing mental health struggles, with my female OB/GYN. She looked at me, almost amused, and said, "Women have been doing this for thousands of years." My mental health spiraled, and I developed severe preeclampsia. Because of the COVID lockdowns in Canada, my husband wasn't allowed to come with me to any of my appointments. I only had 4 doctor visits throughout my entire pregnancy. He had never even met my OB/GYN. She knew absolutely nothing about him beyond the fact that I had a husband. At my final appointment, I asked again to schedule a C-section. Her response was the same dismissive line about what my husband thought. Given that I was the one carrying the pregnancy in my body, I still can't understand why his opinion was even relevant. What year are we in? Story 47. I went to a gynecologist for the first time in 20 years because I was seriously worried my hormones might be off. I had all kinds of symptoms pointing to it. She didn't run a single test. Instead, she asked if I had a husband or a boyfriend. When I said no, she looked me dead in the eye and said I should find one and get some, because that was probably all that was wrong with me. Then she wrote me a prescription. Didn't explain what it was. And when I went to pick it up, I found out it was an antidepressant. Needless to say, I never went back to her. Story 48. My wife and I had suffered miscarriages before, and she had just become pregnant again. We were seeing the doctor for the first time. After the ultrasound, this guy walks in. We hadn't seen him at all until that moment since the nurses had handled everything up to then. He doesn't introduce himself or ask our names. He just strolls in, tosses his clipboard onto the counter, leans back against it with his arms crossed and says, without hesitation, "Well, you're probably going to have a miscarriage again." That's not something you say to a hopeful mother who's already been through multiple miscarriages. He said some other things after that, but I was so angry I barely remember any of it. My wife was devastated. We left and went to another doctor the very next day. The good news? Almost 4 years ago, we welcomed our little boy into the world. Story 49. When my son was 6 months old, he had an appointment with a developmental pediatrician. I didn't really know what to expect, but they kept doing all these physical tests, like seeing if he could put a raisin in a jar. I asked several times what they were looking for with those tests, and the doctor just said, "Oh, we're just seeing where he's at so we can track his growth." I went home and Googled it. Cerebral palsy. That's how I found out, because the doctor couldn't even tell me to my face. My son is 12 now, and I'm still furious at that doctor. Thank you for watching. If you enjoyed this video, be sure to give it a thumbs up, subscribe, and hit the bell icon so you never miss an update.